All right, now let's look at hypothyroidism. Hypothyroidism is a deficiency of thyroid hormone. A common cause of that is an autoimmune problem. And in this particular case, it's called Hashimoto's thyroiditis. And these patients also produce autoantibodies, but in this case, they're producing it against the thyroid peroxidase, which is the enzyme that converts iodide to iodine. It also will bind to thyroglobulin. And this causes damage to the thyroid by activating the complement system. Iodine deficiency, because iodine is important for or is necessary for the formation of thyroid hormone. If we have a deficiency in iodine, then we will be hypothyroid. And then we'll also see patients who had their thyroid ablated. That may be the result of having their thyroid removed for various causes, or it's something that we would commonly see in patients who had radiation for head and neck cancer. So in patients who are hypothyroid, they would have a decreased metabolic activity. So they would tend to have cool skin. They may have weight gain. Their heart rate is slowed. So whereas in hyperthyroidism we had an activation of extra beta receptors, in this case everything's going to tend to slow down. They're going to tend to be hyporeflexive. They're going to be tired and fatigued. And as far as their GI systems go, they may be constipated. So with hypothyroidism, let's say we see this due to iodine deficiency. With iodine deficiency, we can't make T3 and T4. So in this particular case, a decreased T3, T4 is basically going to take away the normal negative feedback of TSH. So in iodine deficiency, we'd have a decreased T3, T4, but we'd have an elevated TSH. So these patients would also have a goiter. So this is a good time for us to talk about goiter because we've seen goiter both in hyper and hypothyroid states. So goiter simply means an enlargement of the thyroid gland. It means nothing or tells us nothing about the functioning of that gland. So excess stimulation of the thyroid tissue can cause enlargement. So we can see that with an elevated TSH, or we also saw that with the thyroid autoantibodies that bound to TSH receptors, such as with Graves' disease. Another interesting cause of goiter is something called goitrogens, and these are different exogenous substances which can cause the thyroid to enlarge. Certain medications can cause that, as well as certain types of food. Do not concern yourself with memorizing the medications or food, but be aware that sometimes that people have goiter, it's because of odd things such as this. So this was a young woman who came to see me in clinic several years ago, and you can tell that she has a very thick appearing neck. In reality, this is all thyroid gland. So she had normal thyroid function, or was what we call euthyroid, but a very large gland, which obviously caused significant cosmetic problems for her. So she requested that this be taken out. And so this is what her gland looked like when we removed that. So put this in perspective to what kind of a normal sized thyroid gland would be. So large gland goiter in a patient who has normal thyroid function.